In a nutshell, when one is diagnosed with cancer, it's a massive shock and you are then put onto a big roller coaster where lots of things happen to you and you have absolutely no control. We're very good at diagnosis and treatment, but what we're not good at is then supporting people into recovery and survivorship from cancer. And this is where it is absolutely crucial that the rehabilitation services are available and are part of a personal plan for people to help with their recovery from cancer.
I've been involved with this benchmarking project and what we're trying to do is work out what a really good cancer rehabilitation service looks like. And today I'm really excited because we have got a whole room of patients who are telling us what matters to them about their rehab services and what's gone well, what hasn't gone so well, and what a 5-star service to them would look like. And I've been in cancer rehabilitation for many years and yet these guys are the real experts and they know what's important to them. And we're starting this project with the patient voice. So the patients are at the heart of what we're doing and I'm really excited and I'm already learning loads about what they're saying, and I'm hoping that as a result of today we can make cancer rehabilitation services in London better.
In hindsight, knowing that the service is there and that it's easily accessible, and I think from having been close to quite a few family and friends that have also experienced it, they weren't really aware either that the service was there, so I think that's quite key to people like me.
What matters most is that people are actually able to access the services and know where to access the services and what is available to them, and that currently is not an experience that everyone has.
What matters most to me and to other laryngectomy people is to have our speech quality improved. Like I said, some people when they talk, we hardly understand them. It's either they are whispering or not. But we want to improve the quality of our speech so that, well, as much as possible, those of us who are in one profession or the other can carry on with that profession as much as possible.
I do wish that that had actually all been discussed with me at the point of diagnosis. It may be something that actually is difficult to take in, but I think I would have felt much more supported to know that there was going to be aftercare once I'd been through my treatment.
Each symptoms are different. Some people suffer from reflux where you get this kind of acid coming up through it. It doesn't happen to me, but it happens to other people, and that really affects how you eat, how you sleep at night. Some people have to sleep in a semi-upright position, so acid doesn't come into their esophagus and so on. Well, what mattered most to me about the rehab service was actually being able to access a dietitian over the phone and then to get information about how to put on weight. I'm now in the position now where I need to maintain my weight, so I need to have a healthy diet whilst maintaining my weight, which is the opposite to what most people have. Most people have to try and avoid putting on weight, especially when they get to middle age and so on. But also the physical aspects, because I was very weak when I came out. I suffered from a lot of muscle atrophy and also bone density as well.
I mean, I know rehabilitation is, I guess, meant to come after all the cancer treatment, but I think something that was actually integrated into the chemo. I mean, I had chemotherapy, 8 rounds of chemotherapy and surgery as well, so I was lucky that I didn't need radiotherapy, but I think something that could have taken place alongside my chemo, because that's when I had a lot of the physical side effects, would have been amazing. And then for that to follow on, maybe anywhere between 2 to 5 years, I think is realistic, because I don't think it really hits you until you've come out of the system, so to put it, until about a year after treatment's ended. So it's really important to have that going on long term.
For me, a 5-star rehab service would be a service that has a holistic approach. So it works as a joined up service with the initial treatment, so that everything actually works together, because post-treatment there is a lot of rehabilitation that needs to happen. So a good service would be one that actually builds that into the patient's treatment plan initially, so that it's not something that you actually have to go and find and access afterwards. It should be part of your treatment.
A 5-star rehab service would be something where you have an individual integrated plan for you. So obviously having an integrated care plan for you based on your needs and assessment. And also, I think, is understanding what's behind that plan. In other words, understanding why you're eating the right type of food, and which is very kind of healthy. For example, for me, I was told to eat lots of fats because there's more calories in fats than there is in carbs and protein. But I didn't want to come back in 2 years' time with a heart condition, and therefore it has to be sort of tailored towards you.
The key is for all the services to be joined up. There needs to be communication between each of the different services to ensure that the patient recovery path happens smoothly and they get access to everything that they need.